So I will take you live on the website. First of all, showing you the main navigation pathways. So when you come to the landing page, you have the different parts of the database organized by types of content. So everything that is related with the rare diseases, the scientific information, the drugs, and then the directories of all patient organization, expert centers, medical laboratories and tests, all the data pertaining to research projects, trials, registries, biobanks, and infrastructures. And then you have a directory of professionals and institutions that are performing all these activities. And surprisingly, is the second most used part of ORPHANET. So people are coming to retrieve information on diseases, but also to look for professionals. And then we have a collection of thematic reports that are the ORPHANET report series. You can navigate across languages here. So you see that now the website from the last week is in 9 languages, the Czech being I will show you that because we are so proud. The Czech is the last language having entered the ORPHANET website. So at this menu is present in all the pages of the website. So at any moment you can switch languages. Of course, the usual social media thing, for which I'm not familiar to at all. And then at any moment, because that is always present in all the pages of ORPHANET, you have this burger menu. And when clicking with the burger menu, you open this by these thematic sectors, and then you see more in details what is in there, and you can go directly to the particular pieces of information, and then you can open and close that as much as needed. That is new from last year, of course, that we are together with Eurordis, I'm sorry, producing or retrieving all the information and recommendations on COVID and rare diseases. So I will just open it, that are using a special page in Orphan News, that are so in Europe, but also in France, because our ministry has decided that to delegate to us the maintenance of the compilation of all the information on COVID and rare diseases, and the ministry landing page is rare diseases landing page is pointing to ORPHANET. Then you have some general information about ORPHANET and the countries in it, so you can go directly to the institutional pages in each country. And then you have direct links to other assets like the newsletter, the ORPHA data that I showed you, and then the ontologies. Some interactive pages that are allowing experts to contribute to scientific data in ORPHANET, to register their activities in ORPHANET, and that is the less used, I'm sorry to say, sponsorship. So when some caritative people want to contribute to ORPHANET, that's for the joke. And then we have this report series and other websites and events that you can also find in ORPHANET. So, but this landing page is the less used one because people are coming through Google. The vast majority of people are coming through Google. They are looking for a specific disease. ORPHANET is in one of the first results, or in the first result most of the time, and then they can, the users come directly to the disease page. So I will take more time in this disease page. In the disease page, you can find the disease by the disease name. For instance, I don't know, for instance, we will put cystinosis. So you have an autocompletion. Then you can click on it and then search. You can search by OMIM number. If you know the ORPHA code, you can look by ORPHA code, by ICD-10 code, but also by name. Of course, you can retrieve the alphabetical list of diseases if you want. In all the pages, you will have the same color code than in the landing page by theme. And then you will have the same menu that you have seen here in the burger menu. So you can go directly to these pieces of data, the clinical signs and symptoms, the classification, the genes, the disability facts, the texts, and then the procedures for each page. But you will see that going directly to the disease page, you will find all this information. So that is you need to choose exactly what you look for. So we will go to cystinosis, and all these elements are also at the bottom of the page, and I will show you that later. So in the disease page, you always have a disease definition, and this disease definition is also part of the nomenclature. So people downloaded the nomenclature also have the definitions in order to help them to use adequately the ORPHA codes. And then you have the ORPHA code here. You remember my tree, that is the classification level. So that is a disorder, it's an orange point. But if it was a subtype, then you would have that noted here. And by clicking here, you will go directly to the classifications in which this disease is classified, and you can navigate the classifications. Then you have a kind of identity card of the disease with the pseudonyms, the rank of prevalence, the inheritance, the age of onset, and then the codes used in other terminologies. And then you have the summary information that is the more and more done in collaboration with ERNs. And of course, you can click on the ERN and go to the information on the ERN, so you can navigate to find all the centers that by country belongs to that ERN. Then you have the detailed information. So for this disease, we have either produced, either selected texts for in different languages, and all the teams in ORPHANET are retrieving and assessing these texts. For instance, clinical practice guidelines, guidance for genetic testing, and so on and so forth. Depending on the availability of text, you will have also other kinds of texts like anesthesia guidelines, emergency guidelines, and so on and so forth. And then you have all this, the same thing you have here. You find them at the bottom of the page. So if you want to go to the node for the genes on this disease, is this one, and then you go to have information on the gene, and you know how many other diseases are depending on this gene. I go back. You have the clinical signs and symptoms, and then you will have the phenotypes that are very frequently, occasionally involved in that disease. But I want to show you something different now. If I go for another disease for which there are published diagnostic criteria, when there are clinical signs and symptoms that are part of the diagnostic criteria for a disease, they are marked as such. And then you have the distribution of clinical presentation by frequency on the disease. If I go back to my cystinosis page, you will also have a direct link to PubMed that will play the PubMed query automatically, and then the links to other websites. And then you can go to look for the most relevant expert centers, diagnostic tests, patient organizations, and if there is any orphan designations and drugs for this disease, and the same for research projects. Of course, you can go directly in the burger menu, look for the expert centers, and then by disease to access the same results that you will have by clicking directly here. For instance, if I go to expert centers, I can filter. So by default, you have all the medical management and both adult and child, and all the centers designated or not, and all countries. But then you can filter by country. You can choose to show only the designated centers, only the adult, the clinic, the child, or the only genetic counseling, or both. But then you can also search by expert center name. By default, the results are organized by specificity. So the most specific ones first. So if there is a clinic or specialist center that is on cystinosis, it will appear first. And then if there is a center that is dealing with the group of the diseases in which the cystinosis is, then they will be listed in second, third, and so on and so forth. You have the logo when it's a center that belongs to the European Reference Network, and if it is nationally designated as a center of expertise. The same is for patient organizations, for instance, is the same principle. When you go to the disability, that is so a smaller list of diseases that have this kind of data, but that is something that is very important because it's kind of the same organization of information than clinical signs and symptoms, but dedicated to the functional impacts of the disease. And that is something that is really innovative because and very hard to do because it's a knowledge that is not published or very scarcely published. And then we work together with experts, the more and more with the European reference networks, and with patient organizations, and with professionals of the medical and social sectors to build this knowledge out of their experience. And that is why it's a very hard thing to do, but almost 1,000 diseases have already been treated. So this in this you will have terms that are coming from the International Classification of Functioning of the WHO that we have adapted in order to treat the population of patients and not a single patient each time. And then you will have the frequency of these impairments and the temporality and the severity. So, for instance, you can have an impact on hearing and listening as a permanent limitation, but with a moderate severity. But very frequently, you will have a severe acquisition delay on hearing and listening. And so you see that you have absolutely everything that can happen, but not that won't obligatorily happen for a given patient. So that is really on the population of patients, and that is more intended to the evaluation in order that all the potential impacts are looked for and the proper measures to limit these disabilities are put in place without forgetting anything. So also the environmental factors that could have an influence on the disease course or the functional impact is also retrieved. That is the kind of texts that you can find, and you can find the emergency guidelines that are produced in French and translated in some countries that can translate and adapt to the regional situation. But all the other texts that are here are retrieved from the published literature or other projects like orphan anesthesia, and quality assessed and present in multiple languages. So you have these emergency guidelines that are really for the emergency departments and the ambulance to take into consideration the main urgent things and particularities related to the rare disease, and the emergency phone numbers to reach the experts on the disease,